Welcome to the 3 best Botox techniques for 20-year-olds, and it is great to have you here. Thank you for spending the time. So we're going to jump right into this because we do have a lot to go ahead and take care of. And I want to show you. And a lot of you are thinking Botox techniques for 20-year-olds. Yes, that is kind of where we are these days here. So that is exactly what is happening in the world. So let me just get all these buttons to go ahead and do what they're supposed to do. Let me just go here. All right, here we go. I think now we've got it here. So my name is Dr. Louis Maltzmacher. So welcome to all of you. It is great to have you here. There's my email. If you ever want to get a hold of me, there's the AAFE's email. I'm president of the American Academy of Facial Aesthetics and a clinician just like all of you. And I've been doing aesthetics and teaching aesthetics for 15 plus years already. And the AAFE is the largest live patient certification training program that is around probably anywhere. And there are a whole bunch of websites that are on here, so I welcome you to go visit them. We'll probably touch base on some of those as well as we go through this program. But there's a lot of great information for all of you right there. So make sure you take advantage of all of that, and make sure you go ahead and follow us on all the social media platforms where we post clinical information every single day, whether it's cases, whether it's practice management, but everything to do with your practice there. So, I mean, we've got really tens of thousands of followers across all platforms with millions of views. So we're thankful to all of that and all of you for being part of our community and our wonderful program there as well. And really what we're all about is live patient certification training. That is really what we're all about at AAFEtraining.com. That can answer all of your questions. It always has the best tuition deals, and you can see whether it's foundational level 1 Botox and dermal fillers, level 2 advanced, level 3 master, and then oral facial pain trigger point therapy. And we've got cadaver dissection courses, master nose, lips, eyes, you name it, smooth and lifting PDO threads. But we're going to stick to our topic of Botox for 20-year-olds in this program here, but certainly we give lots of different webinars and lots of different topics all the time. But definitely go to AAFEtraining.com. That is the best place for you to go. It's a dream practice with injectables. I just want to go ahead and cover this, especially now. It's really a dream practice when it comes to injectables. Why should you have injectables in your practice? Whether you're new to this, you've been looking at adding this to your practice, or you've been doing it for a while, you need to up your skills. Why? It's a recurring revenue center in your office. It's probably one of the few things that you have. It's elective, it's aesthetic, people pay for this. There's none of this insurance nonsense that you've got to deal with. Botox fillers, PDO threads are the most popular aesthetic procedures in the world. They're non-surgical, minimally invasive, only minutes to accomplish if you're well trained. There's no capital investment, no lease payment. You're just investing in your own skill, and that's amazing. That's what we love about it. And finally, healthcare professionals, whether you are a dentist, physician, nurse practitioner, or a PA, whatever it is, you can finally get paid what you are worth. And that is really something. You can't say that about any other part of medicine or dentistry, because this is based on your skill, your training, and advancing your skill. And really, it's like a discipline like anything else in medicine or dentistry. I want you to remember that. You know, people used to think about it just kind of squirting Botox around, no big deal for that. No, it's a really dynamic field, aesthetics, and you should be part of it there as well. And it's the only one that's growing now with all the craziness that's going on in the world, whether it's inflation and whether, you know, some days you wake up and you're not sure what's happening in this world. But this is still booming, and especially it is booming for the foreseeable future. And, you know, through COVID and everything else, this is the only thing that kept going up and up and up. And people want to invest in themselves. Consumers, patients want to invest in themselves to look better. And especially as we get into this, Gen Z and millennials now make up 35% of injectable patients. People would think, what kind of 20-year-old is going to get Botox? What kind of 20-year-old is going to get lips or fillers? Well, they're getting it now more than ever before. They really consider it self-care, just like getting their hair and nails. They're not ashamed of it, like the baby boomers, like my age group, or even younger than my age group. That is really amazing. The AAFE members are up 30 to 48%. And if you've been thinking about doing this for a long time, you wish you would have done it 12 months ago, 24 months ago. So I was just talking to a dentist and also to a nurse at a level 1 course this past week, and they were like, gosh, we wish we would have done this 2 years ago, 3 years ago, last year, 6 months ago. They'd be so much further ahead because AAFE members are up 30 to 48%, and that's really incredible. Really, really incredible for that. So with that, let's get into the topic of 20-year-olds getting Botox. What kind of 20-year-olds are getting Botox? They're even thinking about getting Botox. Well, they see it on social media. And if you don't think they see it on social media, let me go ahead and show you this here and check it out. Let's go check it. And by the way, if you are by the way, I mean, that's all you need to know about Botox, by the way. Just what you saw. Okay, she covered it in not even 30 seconds. This is all you need to know about Botox, especially if you're a Gen Z. That's all you need to know. You know why? She has 16.5 million followers, okay? She told you everything you need to know. You get it. It doesn't kick in right away. Day by day by day, gets better and better and better, and all of a sudden it kicks in, and she loves it. That's all you need to know. And how old is she? She's, in her early 20s, and she's got 16 million followers. It's no wonder they want Botox, right? I mean, that's exactly what is happening for that. So what is going on? It's the injector plus the neurotoxin. So let's talk about botulinum toxins that are on the U.S. market here. And you'll see, and it really is about anatomy, safety, and technique. That's what it's about all the time. And these are the ones that are available, at least on the U.S. market, certainly internationally as well. In some countries, you've got even more for that. They all work about the same. Take your pick. Botox, obviously, is the one that has driven and built this market. Xeomin is a close second. It's less expensive than Botox. Same unit structure. Works just as well. It's a little bit more of a purified. These are all purified protein molecules. This one's a little bit more of a purified molecule. In terms of Xeomin, Dysport, Jeuveau, they're all good. They'll all work. It's about you, the injector, and making these work and knowing the anatomy, the safety, and the technique here as well. And that is really what is going to go ahead and drive everything. But how does it work? It certainly works with knowing the physiology of it, and that is, what do? You go ahead and you inject Botox. I'm just calling them all Botox for right now, even though I mean neurotoxins, but we'll just call them all Botox for right now, and that will go ahead and make it easy for everybody, so I don't have to keep saying botulinum toxin 100 times here. How does it work? You inject it into a muscle, and once you inject it into a muscle, then it takes about a few hours, 2 to 4 hours, to go ahead and bind to that neuromuscular junction. That is what's happening. You bind to that neuromuscular junction. It blocks the release of acetylcholine, but not right away. It takes a few days to go ahead and really bind in there to slow down the motor muscle. Why does it solve the wrinkle problem? Because those wrinkles are caused by motor muscles underneath it that will go ahead and and wrinkle the skin, right? Well, I mean, when I raise my forehead, those of you who have seen me and I go to rest, I've got wrinkles in my forehead because of my advanced age number 1, and we've been doing it for a long time, but skin's natural state is smooth. So I've put Botox in the muscle, and in about 2 to 10 days, that muscle goes to sleep. If I put enough Botox in my frontalis muscle, it goes to sleep. Skin's natural state is smooth, and it smooths out just beautifully for that and that. But some muscles, obviously, we don't want to go ahead and go to sleep. We just want to go ahead and reduce the intensity of contraction, like a masseter, a temporalis muscle. Then we dosage appropriately for that. And that is pretty much how botulinum toxin goes ahead and works. But what you really need to know is you've got to know the anatomy, right? You've got to really know the anatomy there of the muscles. And this is something that all of you learned. Those of you who are dentist, physician, nurse practitioner, or PA, that you all learned in your first semester of medical, dental, or nursing school for that. But now it really means something for you. I mean, right? I mean, that's really what it is. So when you learn these muscles and you learn how to inject Botox into these muscles, you can do amazing things. And through the AAFE continuum of level 1, level 2, level 3, it's amazing. You can literally reshape somebody's face, also get rid of their headaches, migraines, oral facial pain, TMJ, and we'll leave that for another time. But all those things happen together here. But now, if you understand that, now let's go back to the young people and to the 20-year-olds, because nobody wants to grow up to be a no Botox Barbie here. That's what Barbie would look like if she really showed her age today. But nobody wants to look like that, do they? Why don't they want to look like that? Because, like you just saw, people are getting it on social media all the time, and that's exactly what they want to go ahead and look like. But here are the considerations when you're treating 20-year-old patients, 20, 25, even 30-year-old patients for this. And this next patient that we're going to show you is I believe, 27 or 28 years old, and she's been getting Botox already for 5 years. 5 years. So she started young. So what did we look at? Tight skin and tight muscles. That's what you've got. So you don't need a very high dosage for these, because you're not dealing with a lot of wrinkles, and you don't necessarily need to knock out a forehead completely. All you have to do is just calm it down a little bit, and any minor wrinkles that they have start to disappear, and it prevents people from getting wrinkles. People, if they want, it's called prejuvenation, especially when you get to 21, 22 years olds, they don't ever want to have a wrinkle in their life. So you've got tight skin and tight muscles. You've got to know the dosage, which is going to be typically less than others, but you're always assessing every patient for muscle mass, muscle intensity, and really seeing how big is the muscle and what you're trying to treat. So they all go through the same evaluation and diagnosis for that, but very precision placement. That is the trick. And one of the biggest Botox clinical considerations is precision. These are very precision treatments. I think most people don't really appreciate how precise we are when we deliver Botox, and that's what AAFE training is really all about. And you've got to consider their eyes. Do they have shallow, medium, or deep set eyes? So many different things, but none of them want to be a no Botox Barbie when they get older, and they're starting earlier and earlier. So let me show you this now 28-year-old that's been getting it for 5 years. So here we go.
Okay, so now we have Stephanie in the chair again, and we are going to do her full face of neurotoxins. You can see she's got little dots all marked up, ready to go. So I'm just going to kind of go ahead and get started, and as I go through the areas I'm treating, I'll kind of talk about it. So we're starting with her frontalis. So I'm only giving her a total of 4 units of neurotoxin, only because her forehead is kind of short. She's not very strong, and she does have a little bit of hooding, so I don't want to drop her too much. So I'm basically only giving her 4 units. I just kind of added saline to my syringe, just so that I'm pushing an even amount in each injection spot. You can see I'm going right next to the dot, kind of going directly right into that muscle. It's almost like a release of tension, like I'm just popping into that muscle, and then once I'm in the muscle, the neurotoxin pushes in really nicely. If you're ever, turn towards me just a smidge, perfect. If you're ever injecting you feel like you're having a hard time pushing the plunger, you're probably just a little too superficial. Still in like that epidermis, so just get a little deeper into the muscle and it should go right in. Okay, so that's done. Now we're gonna move down to her glabella. So if you remember from her assessment video, she was pretty strong in this area, so I'm giving her a total of 20, so 4 units in each injection spot. So first the Proceris, going straight in and giving 4 units, and then isolating the corrugators and giving 4 units medially and laterally. Again, just going right next to my dot. You never want to inject right through a marker just because you don't want to tattoo a patient, but also just for sterility reasons, just to be clean. So I usually just kind of mark a little off of where I actually want to inject. That area is done. Okay, then kind of coming down to her crow's feet. She doesn't really have much of crow's feet to even speak on. Big smile, as big as you can. So she's very minimal in this area. So I'm only giving her 2 units, like 4 on either side. You can relax, turn your head a little bit. And this is mostly just for preventative reasons. Because she gets injected everywhere else, you can't really ignore certain areas, because then they're gonna start to appear differently from the rest of her face. Turn towards me a smidge. So same thing over here, 2 and 2, always injecting up and away from the eye. Perfect. Okay, then we're gonna come down to her nasalis muscle, so look straight on, scrunch up your nose for me. So we're treating this muscle here. So this horizontal line, treating the Proceris will help relax that. And then these little itty bitty lines that kind of come into a V, those are her bunny lines, that's what we're treating. And I'm mostly just doing this on her because I know we're gonna end up doing nose filler, and I wanna make sure that this nose filler that I place here isn't gonna move. So we're just doing it very lightly. I'm only doing 2 and 2 on either side, kind of following the bridge of the nose. It's a pretty superficial injection and just giving 2 units per side. Also keep in mind for this injection, this is not an area I treat if a patient has to wear glasses or if it's sunny out. Make sure your patients aren't leaving and putting sunglasses on so that it doesn't, migrate down. Okay, next moving down to her mentalis. So do like your sad face. Yeah. So kind of creating that little bit of dimple puckering in the chin, relax. Also responsible for this mental crease. So again, I'm just treating her very lightly. I'm gonna do 4 units total. So 2 and 2 medially right into the center of that muscle. And I'm mostly doing this, again, because I plan on placing dermal filler in her chin. So I wanna make sure that muscle is good and relaxed. Next, we're moving down to masseters. So she is a clencher grinder, so we are going to be treating her masseters. She's not super strong, so I'm only gonna start her at 10 units. If she had a super prominent, strong muscle, 10 units probably wouldn't touch her, but it's really not too bad. So I'm gonna start her at 10 and see where that gets her. Probably check her back in 2 weeks and see if I need to add more. But we are treating her superficial and her deep. So you can see I have 2 dots here. She does complain of some ear trouble, and usually that is an indicator that something's going on with her deep masseter. So I'm gonna treat both. So I just mark my anterior border, go ahead and bite down. You can feel the bulk of her muscle here. Go ahead and relax. And I'm going just straight in and giving her 10 units. You can see I stayed pretty posterior and close to the mandible so that I'm avoiding that risorius muscle. And then the deep is pretty close, far back, right underneath that zygoma. Go ahead and bite down again. Good, relax. And I'm just gonna go straight in, and I'm only giving her 5 there. And then we're gonna do the same exact thing on the other side. So again, bite down, perfect, relax. Straight in. That was 10, and then we're gonna give 5 in this deep as well. So right under her zygoma, go ahead and bite down. Good, relax, and it's just gonna be straight back. I usually angle a little further back towards the ear because I don't want to hit her zygomatic major. And that is it. She got I don't know what her total is because I didn't write it down. But she got quite a bit of neurotoxin, so we'll give that 2 weeks to kind of settle in, and then I will see her back for a 2-week follow-up and see if I need to do any enhancements.
And now let's look at this before and after just from her botulinum toxin treatment. She's going to have more treatment. And remember, she's been getting this for 5 years already, but this is her making a mean face. Afterwards, she can't make a mean face. It's nice and smooth. Raise your eyebrows. Afterwards, you can raise your eyebrows a little bit, which maintains the shape of the eyebrow. Make sure you know how to apply botulinum toxin to the forehead to get this kind of a look. And then here is just side by side, full face at rest. She looks great. Everything's a lot smoother. We've already enhanced her chin in this photo here as well and done a few other things. It's time for you to learn this, and it's time for you to get AAFE certification trained today. And here you can see her before and after again, as you can see. Now, she's an old lady already, right? At 28 years old, she's an old lady already, and so she gets quite a bit of neurotoxin and for all that. By the way, all the dosages that she mentioned are only specific to her. If you give these same dosages to another patient, especially a younger patient or even a patient her age, may be totally different. I mean, every single dosage thing, that is the failure of so many injectors, especially, and I've got to blame their training, not AAFE training, because we do not teach cookbook, but so many other people have been trained cookbook. You always give this many units in the masseter, in the forehead, no matter if it's a man or a woman, if they're 20 years old or if they're 80 years old. That is so wrong, and that's how you get such messed up treatments and so many messed up patients with that. This is very individualized treatment, so whatever was given for her is no indication of what the next. I mean, just like, you know, my prescription eyeglasses does not mean if you are an optometrist, right, that the next person that comes in, you're going to give them the same prescription because they're totally different. So that's something for you to really, really remember there. And then we can show you the different angles on her, and she just an amazing treatment. And by the way, there's other treatment that we can certainly do on her, and she had lips done if you look carefully there as well, and we'll show her in future online trainings there as well for all of that. But you've better make this comfortable for patients. I will tell you that. If you don't make this comfortable, especially for younger patients, they are gone. They are going to go somewhere else because, you know, the expectation is nothing should hurt. And if you want to use the sharpest needle that is out there, it is by far ComfortTox. It's the only one that we use in AAFE training here. Why? It's great for precision placement. That's what this is all about. Quick, easy, very little trauma because it's so sharp. It's got a special super sharp technology with a multi-bevel surface. Look at these micrographs right here, and this tells the whole story. Right out of the package, the ComfortTox is super sharp. There are no nicks and blebs on it or anything else like that. The other one is a popular brand of insulin needle that is used a lot, and it drags, it tears as it goes into the tissue, and it's a lot less comfortable. In other words, it hurts. And that's not what you want. You want to be the most comfortable injector, especially for younger patients, and then they will come back for you. You can get this at stattds.com for this. So let's go ahead and show you another patient here. We're going to show you her treatment video. And this next patient also, same kind of a thing. Tight skin and muscles. You've got to adjust the dose for prevention. She's going to get definitely a lower dose, very precision placement, and they don't want to be a no Botox Barbie. This patient is 21 years old, and she was referred to us. Listen to this. This is, I think this is amazing. She was referred to us by her boyfriend's mother, who obviously is much older than she is, and said, oh yeah, if you want your lips done, she first came in for lips, you want lips done, go to the AAFE Training Center, and if you want, and they'll give you Botox too and that kind of thing. So let's take a look at her Botox treatment. Kind of amazing here. So let's take a look at this right now. Patient is 20 years old and getting some botulinum toxins. So what are the considerations Well, you've got to make sure it's a great experience for this patient. Let's start with the frontalis and the glabellar area. That's all we are doing right now. ComfortDoc syringes for the best comfort, because you want them to come back forever. But it's about precision and making sure that you understand on a patient like this that they have very tight skin and very tight muscles here, and that means that you have to be precise. You're not going to get a lot of volume and diffusion here, so you have to know exactly where you want to go ahead and put it, as you saw in the frontalis. And you must adjust the dose, and that's important. They don't need as much as an older patient because they have not made those dynamic wrinkle lines in the skin. That's the Proceres injection. Now let's go with the corrugator injections. This whole thing is not even 2 minutes. It's less than that. Here are the corrugator injections. Make sure you are placing it exactly where you want it. Hold that properly as you see being done so that you don't get any movement of the botulinum toxin down into the eyelids, and make sure we are not using a full dose as we would with an older patient. She doesn't need it because we just are doing prevention now to prevent those wrinkles from going ahead and getting deeper over time here. So we just want to weaken the muscles. You may not have to knock them out. Now cleaning this is so important. Up and away from the eyes constantly. You want to make sure you go up and away from the eyes, so make sure you don't move it all around a lot, and give them proper post-op instructions. And here you see before and after. Now you don't see much when it comes to a prevention case like this, but you don't want to drop the eyebrows, you don't want to drop the eyelids. You want to make sure that the patient has got a little bit of movement, because again, we are talking about prevention, so she doesn't need a full dose because she doesn't have the muscle intensity that an older patient is going to have, and that is demonstrated by not having the wrinkles that she has so far. So that's what prevention is all about with a 20-year-old. So make sure you know those considerations, and it's time for you to learn how to do this, and time for you to get AAFE certification trained today. And here you can see, again, her before and afters for that. I mean, take a look. She grew some lips there too, didn't she? She absolutely, that's what she first came in for. And that is, by the way, the first thing that most younger people, especially 20-year-olds, come in for is they come in for lips. Why? Because, again, they see it on social media and they don't really have much in terms of wrinkles, but they see the slightest thing, or they're interested in what is called prejuvenation, and that is something that every 20-year-old now, that's what they see, and that's what they want, and that is why this generation of Gen Zs, and there's Gen Z 1 and 2, and there's millennials are getting older already for all of that, but all this entire generation, this demographic is now up to 35% of injectable patients, which is really, really amazing already. And they want it. They want it now. And again, they'll invest in it just like they will for hair and nails and everything else, self-care. And they are not embarrassed. They are putting it all over social media. So it is a great time to be an injector or to get into this field, because these patients are going to be around the rest of your career. I mean, seriously, the rest of your career and the rest of my career as well here. Once again, please follow the AAFE on all the social media sites, Instagram, Facebook, YouTube, and TikTok, where we post clinical information every single day, practice management cases. You'll love it. And thanks for being a part of our community there as well for all of you. And AAFEtraining.com. This will answer all of your live patient CME certification training. And please take CME certification training. And this is important. If you ever have a patient complaint and you get approached by your licensing board, if you learned it from Sally on Instagram because she's got a lot of followers and she's been injecting for years, and now she puts on her profile she's an expert trainer for that, and you ever have a problem, the first question that any licensing board will ask you is, let's see your certification training. Well, yeah, I learned it from Sally on Instagram. She has a lot of followers, and they will laugh in your face. I literally just had this situation of a licensing board that because we're a resource for most of the licensing boards, medicine, dentistry, and nursing, and they literally sent me, and they literally laughed the person out of the place, and they got a nice fine there as well for not being properly trained. So this is super, super important important for you, and they all know the AAFE. I mean, that's for sure. But it's more than that. You really want to learn this. You don't want to waste money on really half-baked training. You want to learn this, and you need the post-course support, and that's what the AAFE is all about. We've got 60 faculty around the country. We've got 5 full-time faculty members. The entire AAFE team is here to support you to be successful in this, and we will really push you to integrate this as fast as you can into your offices. That's really what is so important, because we know as soon as we train you, the faster you start doing it, the more successful you will be. Then you move on to level 2, level 3, and all of those different things. So we're really here for your success. So here is my information there again, Dr. Lewis at facialesthetics.org. If you have any questions for me after this webinar, I'm happy to go ahead and address them there, and we can go ahead, AAFEtraining.com, for all of the live patient training, the best tuition specials you'll see right there. AAFEvirtual.com, that is smooth PDO thread training, the only virtual certification CME course. Ultrasound, Cadaver Lab, StatTDS.com, it's got all the ComfortTox products there too, and vsoftlift.us, we'll keep that for another time. PDO threads, lifting and smooth, that's the only one that we will use. Why? FDA cleared class 2, but they're the strongest in lifting. They're the most collagen biostimulation in smooth PDO threads, because we need only a few of them to get a huge result, unlike many of the other threads that are out there. Wave Aesthetics is a great ultrasound for facial aesthetics, and AAFEwebinars.com, so make sure that you go ahead, keep checking that page, because we always have upcoming webinars, and we invite you to be part of that program as well. So we really appreciate it. Thank you so much for being part of this, and continued success to all of you. We'll talk to you all real soon.